give a quick update.
Thanks, Shelley. Good morning, everyone. And wanted to echo Shelley's thoughts about acknowledging the work of our public health folks, especially our local health directors who've been really doing the yeoman's work of responding to this pandemic. So hopefully everybody can see my slides. Wanted to lead off saying it's really encouraging to see that local municipalities are starting to take events into their own hands and to issue mask mandates to protect their citizens. I think that's commendable, but I also want to remind everybody that we have a long way to go, and we should not think that those mask mandates alone are going to turn the tide. And so wanted to make sure that we don't take that as a win and just become complacent. And there's some lessons, I think, recently about successful countries that have become a bit complacent and what that shows us. So as you can see here, these are the current case curves normalized per population for Japan and South Korea, both of which have been experiencing what has been termed a third wave in those countries, similar to what we've had. They had an initial wave in the spring, wave in the summer in both of those places, both of which were attributed to young people and activities, particularly in nightclubs in the urban centers of Tokyo and Seoul. But now recently have experienced fall waves, and both countries have been held up as a model of coronavirus response. and you can see that even though they are seeing dramatic increases, those dramatic increases on their scale are minuscule compared to what we're experiencing. So you can see this is normalized per million population. So Japan's massive outbreak of the fall has given them a daily case count of 1.6 per 100,000, right? So we're at over 100 per 100,000 in Nebraska right now. So it shows you on a relative scale, how much better they have been at controlling events than we have. And South Korea, again, is at less than 1 per 100,000. Nevertheless, these are big increases for them, and they've attributed it to complacency among the population and even among public health leadership and government, who over the past month or two have really tried to inject more normalcy back into the population. People were tired of not being able to go out to eat, not going to church services. So Japan, about a month and a half ago in early October, implemented this program called Go to Eat, which essentially compensates people for half of their restaurant bill if they go out to dine in a restaurant. So it was a way to encourage people to go out and patronize restaurants and eat out more. Well, the feeling is that's backfired tremendously, as it's fueled outbreaks associated with restaurants and is now associated with this rising curve. South Korea, in the same way, in October, eased a lot of their non-pharmaceutical interventions, opening up church services again, allowing large events like sporting events, indoor dining, et cetera. And they also have seen a significant upswing in their case count. So both of those countries are now going back to restricting many of those activities. And again, as you remember, Japan has been the pioneer of the 3 Cs since very early on, when they recognized that asymptomatic spread and super spreading events were the main drivers of transmission. So they forgot their own lessons for a while, but have now re-implemented all of those things. And so I would expect we'll see over the next couple of weeks that those countries will see their case curves going down. But again, for comparison, look at their total deaths per million over the entire course of the pandemic. So Japan has had 16 deaths per million, South Korea 10 deaths per million. That compares to over 1,000 deaths per million in several of the worst states in the U.S. So 100-fold better than what many U.S. states experienced. So looking again at a similar story in Hong Kong, another country or another jurisdiction that's been held up as a model for coronavirus response. They are also seeing a third wave, and this has been almost exclusively due to large outbreaks in dance clubs that's been going on for the past several weeks. Over 80 cases have been experienced just from one cluster here. So again, a model of response, 15 deaths per million on order of Japan, but they are seeing a similar upswing because of relaxation of some rules and complacency among the population. So we need to avoid that lesson and continue to press. You know, the U.S. as a whole is potentially starting to bend the curve a little bit. You see our 7-day average has started, the slope has started to level off, but again, for relative comparison, as a country, we're essentially at 800 deaths per million for the pandemic. So we are obviously way above where those countries are that have managed the pandemic well. And the price that we're going to pay for complacency is going to be what we're seeing in states around us. This is, I'll end with this. This was a note that a friend and colleague of mine sent me just yesterday evening. He had been working in a hospital in Bismarck as backfill with an organization that's helping to provide emergency relief. And you can see here, no beds in Bismarck, none in their entire referral network. The only thing in shorter supply than monitored beds is uninfected docs and nurses. When all this is written up, we'll find that the back of healthcare was ultimately broken by complete fatigue of local healthcare workers, as well as quality bed availability. We have barely qualified clinical staff treating complex patients. CFR is going to double. It's criminal. And that's what we're looking at very soon if we're not able to dramatically reduce case counts in our communities. So kudos to all of the local health directors who've been campaigning and pushing for additional interventions like these mass mandates that are starting to go into place. But again, let's keep pushing because there's more that needs to be done. Thanks.
Thank you, Dr. Lawler. Any questions on anything James presented today?